tricuspid valve disease. Now, we're joined virtually by Dr. Matt Sample, an interventional cardiologist from Brookwood Baptist Medical Center, to help us with all our understanding. How you doing, Doc?
I'm very well. How about yourself?
All right, fantastic. Thanks for joining us. So the obvious question is, what is tricuspid valve disease?
So tricuspid valve disease is a disorder affecting the valve on the right side of the heart. The heart, as physicians, we tend to think about as being a right and left side, with the right pumping to the lungs and the left pumping to the body. And the tricuspid valve is the valve that's in the right side of the heart and can leak from time to time. And that leaking becomes much more common after we become 65, just due to wear and tear.
So where that we might have an issue like this?
So tricuspid valve disease has usually caused more or less nebulous or non-specific symptoms, mostly fatigue, malaise, and shortness of breath. And oftentimes this goes unrecognized as being related to the valve disorder because so many things can cause that constellation of symptoms. But typically, that's what's most common with tricuspid valve regurgitation.
Well, how do you treat that then?
Well, for the longest time, there was almost nothing we could do about it. Surgery has been studied for the tricuspid valve for many decades, but has never shown much promise. And so for that reason, very few patients get an isolated tricuspid valve surgery. Just this year, the FDA has approved 2 catheter-based devices that interventional cardiologists would put in. One is a valve replacement procedure, and one is a valve repair procedure that we are going to begin doing to patients very soon. Those devices just got FDA approved last month.
Yeah, so I assume that means that prognosis for somebody who might suffer from this improves as we gain more understanding and technology, right?
Well, we certainly hope so. The data that we have currently show that the devices that are available are safe and they are effective with regards to improving patients' symptoms. Longer-term data looking for patient outcomes and survival will be forthcoming.
Is there anything that we can do to help prevent this from happening to us, or it is what it is? It looks like we've got a little technology snafu right there, but we were talking right there with Dr. Matt Sample over at Brookwood Baptist. We certainly do appreciate his time as he was discussing the tricuspid valve disease, and wish we could have finished that up, but we cannot. We're going to move on, and we've got plenty more coming right up after the break. You're watching WBRC Fox 6 News at noon. We still move on.
It's big.